Jonas Hardlot was in mental distress last August and asking for help, but this isn't what he was looking for.
Open the door! I'm not doing it. Open the door now! Should I open the door? No. The clinic is here to check on you. Open the door. I'm coming back with a sledgehammer.
Inside the house, the 34-year-old was coming off a binge of booze and drugs after losing his job and getting in a car accident. Hardlot, who suffers from depression and anxiety, had started cutting himself with a razor.
I cut myself, and I tried to call mental health that morning. And like I said, they tried to give me a runaround when I need to speak to somebody right away.
So his mother-in-law called 911.
Open the door now!
But Hardlot didn't want the RCMP at his door.
There's been people that have been shot just for being mentally distraught, and officers not knowing, okay, this guy just up on drugs and alcohol, and little do they know that maybe that's a cry for help.
And what was the officer's demeanor when he arrived at your door?
Straight aggression.
The RCMP in Saskatchewan respond to thousands of mental health calls a year.
We're trained to help, how to de-escalate situations that involve mental health, but we're not professionals, and we know that.
So the police force has launched a one-year pilot project in Saskatchewan, placing psychiatric nurses in the emergency call center. They're taking 911 calls from people in mental distress and have access to their medical records. They're also coaching officers who need expert advice. Sergeant Burton Jones says the first 50 phone calls showed promising results.
There were 17 times where police did not have to make an arrest and did not have to take that person to the hospital in handcuffs or into our cells in handcuffs or anything like that. The nurse was able to intervene and do an assessment, do a referral, things like that, hook them up with community resources. So never had to do our old-fashioned way, which is apprehend, go to the hospital, sit and wait.
He's diagnosed with paranoid schizophrenia.
For years, city police departments in Canada have been setting up specialized crisis units that pair police officers with mental health professionals. But the RCMP says this approach will improve service to rural and remote areas. A first of its kind in Canada, it's modeled after the system in the United Kingdom, where police are not expected to be the first or only response to mental health calls, something mental health organizations here have been calling for.
We wanted to decrease the reliance on only sending police to really make sure that we're sending other kinds of resources. And that's why this is a step to broadening or expanding what help is available.
What policies were missed? What gaps are there?
Carrie Rigby Wilcox's son Stephen was shot and killed by police in 2018. He suffered from alcoholism, anxiety, and depression. Health records show he had suicidal intent, including provoking police to shoot him. His mother says police on scene didn't know that the night he died.
And if they were given that opportunity to understand that this is a potential suicide by cop, and they might actually handle it different.
Last month, a coroner's inquest into her son's death recommended more mental health training for the RCMP and Saskatoon police. Rigby Wilcox says a psychiatric nurse inside the RCMP call center who could access her son's medical history would have also helped.
I did call 911 to get help to keep my son alive. And in the end, that didn't happen. And so my blame is on myself. And I feel like because I made that 911 call, I initially killed my son.
Open the door now!
In this case, Jonas Hardlot did get medical help, and the RCMP officer seen in this video was reassigned. But Hardlot understands police are put in difficult situations.
Everybody needs understanding, right? We're all human.
He hopes this pilot project will be made permanent and will make a difference for everyone. Bonnie Allen, CBC News, Meadow Lake, Saskatchewan.